So the polymer matrix criteria to be considered for you to select a polymer is that the polymer must allow diffusion of drug at the desired rate that you want. Okay, so the polymer chosen must have certain characteristic where if you want the polymer to release it at hydrophilic environment, then the polymer needs to be hydrophilic. So the polymer should also be non-reactive, inert, non-toxic, easy to manufacture, and inexpensive. Nobody wants expensive ingredients. And the polymer should be stable, therefore it do not decompose during storage of the device, and it shouldn't deteriorate when you keep it in a longer period of time. So examples of polymers which have been used, we have three, which is the natural polymers. Examples are cellulose derivatives, gelatin, shellac waxes, natural rubber. We have synthetic elastomer polybutadiene. Examples are polysiloxane, silicone rubber, nitrile, butyl rubber. We have also synthetic polymer, which are the polyvinyl alcohol, polyvinyl chloride, polyethylene, polypropylene, polymethyl acrylate. Now, the drug. To actually successfully develop a transdermal delivery device, you need to choose drug with certain physical chemical properties. The first one is molecular weight. From previous lecture, the optimal one is below 500 to 400 Daltons, but you can actually consider a drug which is less than 1,000 Daltons. Now, the drugs should have both affinity towards lipophilic and hydrophilic phase, because our skin, if you remember, it contains aqueous and also the lipid phase. The drug should have low melting point, and this because people have found out, for example, ibuprofen, it can exist in different types. It can exist as enantiomers. It can exist as a race mix. So they found out when the ibuprofen exists in enantiomers, it has a lower melting point than the race mix. And this this type of ibuprofen, it actually is more soluble in our skin lipid. Therefore, it actually can penetrate better. So that's why the drug with low melting point is actually considered. Now, biological properties of the drug, of course, it should be potent. Daily dose of just a few milligrams. Like I said, you can't have paracetamol in your drug delivery system where you need at least 1,000 milligrams per dose, and you have to take it 4 times a day. So that's not suitable to be used for a transdermal drug delivery system. Half-life of the drug should be short, so non-irritant to the skin. And normally we choose drug which is prone to first pass metabolism, or the ones that degrades in the GIT, so they cannot take it orally or they cannot be formulated orally. So you formulate it with an alternative delivery system. So this is just a summary of the properties of a drug which is optimum for transdermal drug delivery system. Okay, the next one is permeation enhancers. As you know that our skin's really tight, so we can't actually, how do we improve the permeability or the penetration of our drug into our skin? We use penetration enhancers. So these are agents that promote skin permeability by altering the skin as the barrier. So how you calculate the flux is as shown here. So how does the penetration enhancers work? There's 4 ways. It interacts with the polar head groups of the lipid via hydrogen and ionic bonding. It can change the hydration of the lipids and affect the packing of the head. So you have the lipid head, so it changes the hydration. So it can actually open up a little bit of the head, so then the drug can actually pass through. Increase the volume of the aqueous layer swelling. That's the same. So you increase the swelling, therefore you provide pores for your drug to actually pass through, and you can actually modify the protein, therefore open up the dense keratin structure or your skin cells. You can actually open a little bit of the skin cells to make it more permeable. So ideal characteristic of penetration enhancers should be inert, non-toxic, non-irritating. Action should be immediate. Should not cause removal of body fluid. It should be compatible with other drugs or excipients. Cosmetically acceptable. It shouldn't. It shouldn't have smell, or it shouldn't have a nasty taste. Okay, and it shouldn't be colored such as brown or black. Nobody wants to use it. And of course, cheap. Money is everything. So it needs to be cheap. So how does the drug absorb through the skin? So this is your dosage form here. So it needs to go through the stratum corneum, all right, before it reaches the blood circulation, which is the capillary, which is situated in the dermis here. So for it to actually permeate through the epidermis, when it reaches the viable epidermis here, where you get enzymes for metabolism, if you remember in the first part. So there are some enzymes which can metabolize certain drugs, such as your steroids or your hormones. So once it actually survives that, so if the drug survives that, then only it actually can enter the capillary and therefore take into the systemic circulation. Yeah, this is where the metabolism of the drug happens if the enzymes are available there. So there are differences between topical and transdermal application, or transdermal derived system. Do not think that's the same thing. For topical, we want a localized effect. So when we have itchiness, so we put a cream with probably hydrocortisone to reduce the rashes. So that's localized because it reacts straight to the target tissue and gives a pharmacological action or response. Now, as for transdermal, it needs to go into the systemic circulation. Therefore, the drug is in the blood circulation. Once it's in the blood circulation, it will be distributed, and then it will reach the drug target tissue and gives a pharmacological response. Now, since the drug is also in the blood circulation, it can also be eliminated. So some of the approaches for transdermal drug delivery system, we are going for the patches. So types of patches, we have a liner. So this is an example of a patch. We have a liner. So this is the liner where you have to take it off before you use, all right? All right, yeah, before you use so this is the liner, okay? So you have the drug. So the drug is in here. Adhesive, this is adhesive, it's really sticky, see? All right. Membrane, membrane is a layer that you put to control the drug release, especially if you have a reservoir type of system, and also the backing membrane. Okay, so this is the backing membrane, the brown one, protects the patch from the outer environment. So when you put your patch here, so it protects from the outer environment. So the backing membrane, they are flexible. It has to be flexible. Good bond to the drug reservoir to prevent the drug from leaving. So the drug can't go out from here. So normally it's impermeable. So you can't really use the permeable, because if you have water or anything, it can pass through. So it's impermeable to protect the product inside. Keeps formulation in, and it must be compatible with formulation. So examples are metallic plastic laminate, plastic backing with adsorbent pad or adhesive foam pad. So types of platform, it can be monoliths, which are slabs, reservoir type, vehicle type, film, polymer matrix. Films, it can use natural or synthetic polymers. It can also be porous or non-porous. And adhesives that you use, it has to be viscoelastic materials, which remains tacky or sticky. So normally you use natural or synthetic rubber, polyacrylates, or silicone elastomer. Now, one example of a patch is a drug reservoir system, where you have here a drug layer that is separated from the adhesive. So you can see here, you have the drug reservoir, which is the orange, and you have the adhesive. So this is the drug release membrane, which controls the release of your drug. So this is schematic drawing. So you have the film backing, drug layer, drug control release membrane, contact adhesive, and protective peel script. So, so it's the liner. So this liner just now, the liner. Okay. So the control membrane can be made out of ethylene vinyl acetate copolymer. The layer should be compatible with the adhesive polymer. So example is silicone or polyacrylic adhesive has been used. The release rate, of course, is affected by the polymer composition, permeability coefficient, how easy your drug can permeate through the skin, and also the thickness of the layers. So the thicker, the longer it takes for drug to be actually released through the skin. Now, a problem is accidental breakage of the controlling membrane can result in dose dumping. If you remember, you have the controlling membrane. So if you break that, all the drug can actually be released out to the skin. So example is nitroglycerin. The once a day medication for angina, it uses this type of patch. Another example of a drug we uses membrane permeation control system is copolamine, clonidine, and estradiol. So another one is gradient control TDDS. It still have a metallic plastic laminate, all right, but the drug has different layers. So here we can see R1, R2, R3. Now in R1 we have the highest concentration of drug. R2 medium, R3 is the least concentration of drug because we want the drug to be to diffuse through these layers and therefore release to the skin. Okay. Another one is diffusion controlled TDDS system. So here you have the absorbent pad, you have the drug reservoir, and you have the adhesive ring here. So the drug reservoir actually is directly situated onto the skin for drug release, while the adhesive ring is at the side of the patches. So example is Nitrodol 1 and Nitrodol 2. We uses this system. Nitrodol 2 is the modified version of Nitrodol 1. The drug is dispersed in acrylic-based polymer adhesive with a cross-linking agent which result in a thinner and more elegant patch. Micro reservoir is more or less the same. It's just that it has drug which is in a microscopic form, microparticles. So it actually releases the drug better. So we use silicone elastomer for dispersion technique to form the microscopic sphere of drug reservoir. So if you want to stabilize it quickly, you cross-link the polymer chain with the medicated polymer disc to get a constant surface area and fixed thickness. So it depends on how fast you want to release the drug. So you change the thickness of this layer. So extra coating can be used. As you see, it's in the middle, so produced by positioning the medicated disc centrally and surrounded by the adhesive ring. Now, the good thing about this, it doesn't have a membrane control release system, so you don't get dose dumping. So it follows a zero order release. So you just release the drug bit by bit. So even if it breaks, still you don't have a membrane which controls the release. So example here is nitroglycerin. Another one is adhesive dispersion type system. The drug is incorporated directly into the adhesive. Okay, usually we use smaller molecular weight of drug or compound. It can be single layer or multi-layer or even metric type patch. So this is how it looks like. So you have just the film backing. So you have the film backing, protective liner, and that's it, adhesive, and you have the drug in this adhesive layer. So the adhesive polymer commonly used is polyisobutylene and polyacrylate. Example, isosabide nitrate and verapamil.